Jeff Fladen. I am the board president of NAMI.
What inspired you to get into the mental health field to start?
I ask myself that sometimes. There was two things. One, uh, my parents lived with mental illness, so that was a big part of my life growing up. Uh, but also, I thought it'd be really cool to become an electrical engineer. I had a love at that time when I was a teenager in listening to music and stereo equipment, and I thought I would like to kind of get into designing hi-fi equipment. But then I took calculus, and that changed things for me because calculus was not happening, and I was taking psychology classes, and then I thought, I'd like to be a counselor and get into that. So that started me on that journey. But really, mental illness growing up, it was just part of my life. My father had bipolar disorder. He was a physician. People in our town used to think he was a psychiatrist just because of how he acted. He was not a psychologist. He did internal medicine. But uh, I grew up with somebody that had some of the classic things that you would see with bipolar disorder of can't stop talking, not sleeping, uh, excited about all kind of new ideas and business ideas and just some of those kind of things. Um, my mother had depression a lot, both hospitalized. Somehow I ended up with a career in mental health after that.
Yeah, and for me, I live with bipolar disorder too, and it's always good to talk to people that have similar stories because it makes me feel like I'm not alone. Do you feel the
Mhm.
same way?
I do because I've been involved with NAMI now for about 13 years, so it kind of skips a lot of things in the middle from beginning to now. But most of the people that come to NAMI, whether they're volunteer uh, teachers and support group leaders, program leaders, or whether they're staff or whether they're board members like I am, typically all have had deep personal connection with mental illness, whether themselves or as a caregiver, and a lot of times both. So pretty much everybody that we see, uh, we like to say in NAMI, they turn their pain into purpose sometimes, or you could call it paying it forward. But one of the things that struck me, I'll put it this way, is uh, I might have had periods of sadness, but when I was first diagnosed with depression, it was pretty bad. It was difficult. I saw a psychiatrist. I was on meds, did therapy, um, somehow got through and was able to hang on to employment at that time and insurance, got through it. But I told myself then, I would like to use this to help others. I felt that at the time. If I recover from this, I'd like to help others. It took a while to get to that. Maybe not, but where I find myself with NAMI now, it's really all about people not feeling like they're alone and helping other people.
How did that journey to NAMI begin?
Well, we've had cold weather lately, and I could say it started with cold weather. I had become an executive director outside of mental health because I have four children, and I thought I'd like to retire one day and maybe help my grandkids with college and that kind of thing. So I was working as an executive director totally outside of mental health. But I was seeing a lady who I'm still with today who lived in Nashville, Tennessee. And I had lived in Nashville, but I moved to New Hampshire to be an executive director. And it was very beautiful in New England, a lot to do, uh, beaches, beautiful autumn, but a lot of snow, which brings me to the past week. And she would not move up there. She's like, I'm not into the cold. You need to come to Nashville. And I looked for a job to be an executive director again because I'd had that skill set of raising money and managing a staff and doing events and programming and making it all work, doing some advocacy, but none of it was for mental health. And I saw a job on a job board in Nashville for NAMI. And I'd heard of NAMI, but I never really had any direct connection to it. I wasn't working in mental health at that time. I did work for quite a while earlier in my career as a clinician, an employee assistance program counselor, program manager for outpatient psychiatry. I had a mental health background, but I had moved more into nonprofit leadership. But when I saw the job in Nashville, I called the president and I said, you may not be planning for relocation, but I'll come to Nashville if you'll give me an interview. You don't have to pay my travel. I come to Nashville. We met, and it was a match. Uh, he liked me. The board liked me. And so I had things that were valuable to NAMI that not every NAMI leader has, which is fundraising experience, uh, writing grants, uh, planning events. I had created a film festival when I was in New Hampshire, nothing to do with mental health, uh, but it did have to do with budgeting and tickets and organizing and those kind of things. So I had the mental health background. Uh, I had experience as a caregiver. I had personal experience with the mental health condition. And then I had this executive director background. And so that served me very well. So that brought me to NAMI, which I did that for 10 years as the executive director of NAMI Tennessee. And after I hate to say retired, but retired from that. But I during that time I had gotten elected to the national board, and now I find myself as the president of the board, which is really a meaningful opportunity. So that happened for me. So now I'm like many people with NAMI. I work as a volunteer.
So I'll take a step back. Can you tell me about NAMI?
NAMI, yes. NAMI, how could I explain it this way? First, I'll say what it's not for people not aware. No doctors, medications, therapies. We don't do treatment at NAMI. It's really more along of support and education and advocacy, but it's expanded really a lot from there, really to mental health awareness, mental health literacy, um, prevention kind of things. So NAMI began not too much unlike Alcoholics Anonymous, but instead of two drunk guys that got together to learn how to be sober, it was some moms that had adult children that were living with schizophrenia or other serious mental illness. And it was almost 50 years ago. Didn't have the internet back then. There was not much for the parents other than sometimes giving them the idea that they caused it, that they're responsible. Uh, when I was in school for my social work degree, uh, we talked about the schizophrenogenic mother that put the child in double bind. The theory was they wanted the child to come here and they wanted the child to get away. And we blamed the mothers for causing schizophrenia. So these mothers came together, and even if there was treatment then, we didn't have insurance like we have today either. Uh, if somebody went to treatment, the patient was the patient. There wasn't really much for the parents or caregivers that often really, really wanted to help. So these parents got together and they began to just share information of how they coped, what they learned, giving each other support, and it turned into support groups that actually became nationwide. And there was development of local, we use the term affiliates, a local chapter of NAMI, which there's over 600 of them around the country. But in time, The support groups were for caregivers, and classes were added for caregivers, such as well-known class now, NAMI Family to Family, for caregivers of an adult with serious mental illness. Then we had a class developed called Basics, which was for caregivers of a minor child. And it teaches about the illness, that you didn't cause it, you can't control it, you can't cure it. So, what do we do? How do we learn to cope? How do we learn to take care of ourselves? How do we learn to be healthy, but also advocate for our loved ones? So, a lot of NAMI is also advocacy to try and get our policymakers, our congressmen and women, our legislators, state and federal level, to cover mental illness the same as any illness, to be sure there's coverage, that we have a robust system that can support people, because we have a mission of making things better for those impacted by mental illness, but we also strongly believe that recovery is possible, that people can and do get well. And quite frankly, this has been an evolution, because in the early days of NAMI, I think a lot of the goals were, let's keep my loved one out of the hospital. And I was guilty of that myself early in my career. While I was still working on my master's degree, I worked at a community mental health center as a case manager. And we developed treatment plans that were things like stay out of the hospital, will not hurt myself, I'll get help if I feel the need to hurt myself. It wasn't much about recovery and living life and having a good life. And we've learned that people can have wonderful lives living with a mental health condition, the same as with other conditions that may have symptoms and challenges, but it's not the whole person. It's a condition or an illness that we can learn about and find ways to cope with, and many do quite well.
Yeah, for me, I work with my local affiliate, NAMI in Prince William County, Virginia, and I'm even in our own voice presenter. So NAMI has really impacted me. How does it feel for you when you hear stories like that of people being impacted positively by NAMI?
Well, first, thank you for what you're doing within our own voice. It's a great program, and that's where we take people, and we usually pair them up with two people,
Yep.
and they um, have some practice, some training in sharing their story and moving from some of the symptoms and challenges at the beginning to their road to recovery. And it reduces stigma, because people see folks that may not be what they think of when they think of someone with mental illness, someone that's articulate, someone with a job or a family, or it could be somebody that's worked really hard just to stay out of the hospital, uh, and work to help other people to be well. Every story is different, so it's really great that you're doing that. And I encourage any community group that wants to learn more about mental health and recovery and get rid of stigma and hear about hope and some uplifting stories, go to NAMI.org, find your local affiliate, and reach out and ask if they have in our own voice stories. But for me, before we had in our own voice, I was a case manager, and sometimes we felt like we were putting band-aids on situations, to try and keep people out of crisis without as much. There were some employment programs even then, but there wasn't as much focus on living well and recovery and those kind of things. So I felt then that it'd be good if we could do some more at the systems level. And to me, like where I'm at NAMI, I don't teach the classes or run the support groups, but thank goodness we have volunteers that, for their own recovery, they're helping other people. And so it's very gratifying to work with Oh, I couldn't even begin to estimate how many thousands and thousands of NAMI volunteers there are. But to work with a great national staff, I've worked with states and affiliate staff and heard what they're doing, a lot of the innovative efforts and programs that I think we're really making a difference. And there's life with mental illness. So we put out a book called "You're Not Alone." We've really tried to beef up what we have on our website to give education about pretty much all kind of issues. We've started a new initiative around AI and mental health chatbot bots to not that we're offering them, but we want to help make them safer. We've seen the headlines of some of the bad outcomes that some cases have had, and we also recognize that many people don't have access to therapists and turn to this new emerging technology. So we're working with a psychiatrist at Harvard, uh, Dr. John Toros, to try and learn ways to make it better. And he has a lot of experience with this because when mental health apps began to come out and grow popular, he started a project that did not recommend any app, but it told you about, are they private? Is there privacy? Is there good? Is there any research? Are they measuring outcome? What do they cost? And so consumers, if I can use that term, not as a mental health consumer, but just people that are seeking services and products, there's some guidance to help. And so this is a new thing. We've just started this in the last few months, but I'm excited about it because the chatbots are here. So that we can have some impact, I think is really great. We know we've had a lot of impact with Congress because the NAMI network is amazing when it comes to advocacy. And when we put out the call trying to uh, save funding, like you may have noticed about 2 weeks ago, there was a big cut announced at night for a $1 billion reduction in contracts around the country for substance use disorder and mental health. They would have cut a lot of programming that people depend on. And we put out the call, and other organizations put out the call, and within 24 hours, those dollars were restored. So we don't win every battle, but we work hard with bringing people together and helping them to hone their story and their message and visit with their legislators. You're not so far from DC, so I'm not sure if you've taken advantage of that. But in in 2017, we do a national conference every year, and in 27, sorry, that will be in Washington D.C., and we'll be visiting the Hill. But most NAMI states have Hill days where we visit state legislators as well. That they have a big impact on funding for things like case management and what Medicaid covers and what crisis services are available in a state. So it's powerful. And because the legislator likes to listen to people that live in their district and could vote for them. So we do a lot of that. We consider ourselves the largest grassroots mental health organization in the country and able to work with a lot of people to make change.
What is it
It's a
like being
privilege. It's a privilege for
yeah.
me.
Yeah, with that, what is it like being a part of the national board?
Well, the national board is it's interesting. So I had been on boards for a long time as the executive director, and it's always confusing unless you're on a board. What are they for? Other than people are nervous, we've got to keep the board happy. Um, so, in its simple, at its simplest, the board hires or fires or evaluates the CEO or the executive director. So we do that. The board does approval of the budget and has the word that I try not to be too confused by, but a fiduciary responsibility, which means we need to be sure that the money is spent for the charitable purpose. Uh, as the money comes from donors, and we thank and appreciate every donor. but that the money is used wisely in support of the mission, the charitable mission, which for NAMI is to make things better for those impacted by mental illness. So that's part of it, is we approve the budget and then also planning how are you going to do this mission? And so the director runs things and they manage the day to day, but what are we going to do to try and make things better for people? We plan that and then we look to evaluate, are we on track? So what is the purpose and are we fulfilling the purpose? That's the board, not running things. We hire an individual that's in charge, and then they run the day-to-day operations, which for us is a gentleman named Dan Gillison, who is a wonderful CEO, and I really enjoy working with him, and we kind of work together to pilot the jet.
What do you do to help your own mental health?
Well, it's a good question, and I do take care of that. When I was still working as an executive director, I worked a lot of hours and loved it. It was a great job, and I was executive director over 20 years altogether, but 10 years of that was with NAMI Tennessee. So I began really once COVID started. I was working from home. Maybe it was a little before that, but I began taking off Friday afternoon because I worked a lot of nights and weekends, and I do photography. So I would go out with my camera and journey around, and during COVID, even more, just exploring my state, which Tennessee is a very beautiful state, which has three distinct parts that are very different. In Memphis in the west, it's pretty flat, and the Ohio River. And then Nashville has hills, and the city, Middle Tennessee, and the east you have the Smoky Mountains. So it's varied and it's very nice, a lot of beauty, but it's spread out. So I did a lot of exploring, and then to this day I try and go every Friday. So I'm in my car driving to a nature reserve or a waterfall or something like that, and so I'm listening to music. Then I'm out in nature, uh, hiking around, taking pictures, come back home. So I try to make that a weekly practice. And if it's rainy or cloudy on Friday, then maybe I'll do it on the Saturday. So I have the privilege to be able to do that. But also, I'm a regular practicer of Tai Chi, actually, and I do that also
Wow.
3 days a week. It's at my local YMCA. So people that think they can't afford Tai Chi, you have to go to a class. Uh, at least where I live, it's at the YMCA, and it comes with your membership. So I like that quite a bit too. It's got deep breathing and gentle movement and that, and so I do that also.
Where do you want to see NAMI in the next, say, 3 to 5 years?
I don't know that we can do it in 3 or 5 years, but I'd like us to be as well known as the Red Cross and the American Heart Association and March of Dimes and those kind of organizations. Uh, I'd like us to be at the table where there's policymakers, wherever they are, or educators, school systems, universities, where people are thinking as they're doing more, thinking about mental health now. Uh, I'd like us to be at the table. I would like us to continue to focus on valuing and honoring and utilizing lived experience, whether it's caregivers or also people that are living with a mental health condition. And that's changed quite a bit in my time with NAMI, that there's a lot more emphasis on having peers, I mean, certified peers, when I say peers, certified peer support specialists providing services within their community. And we have quite a few executive directors that are peer support specialists, which is cool to see. I'd like us to continue to get younger, and it's a little touchy to talk about diversity these days, but I'd like us to be welcoming to all populations, which sometimes means some different kind of outreach, like translating things into different languages and partnering with churches or different groups so that leaders of those communities might want to come into NAMI and be trained in using our materials and our programs and presentations so that people are hearing from their own community. So there's those things. And then how do we navigate the new technology that's all over the place? Like we were not doing a lot of support groups or classes online until COVID came along, and then we all began to
Yes.
do programs and services online. Um, we want to maintain and support our alliance, which includes the 600 affiliates I mentioned, and where you're involved, and the state organizations. We'd like to um, not undermine them, but we recognize that some people like to get their information through the internet. So how do we evolve uh, without undermining our grassroots nature, but that we can meet people where they are and help them to get support and education and information the way that they would like to receive it. So that's rapidly evolving.
How can people reach out and learn more?
NAMI.org is the website. NAMI.org. Just go there, and there will be a place there where you can find your local NAMI, which usually is a NAMI affiliate, which some of them are a city, some are a county, some could be multi-county. Uh, Connect locally or nationally. And also, I will just give a plug. We do have a conference, and some years it's online with a very, very low cost. Other years it's in person, which costs more because there's meals and it's in a nice hotel. And so the conference will be, I don't have the dates with me, sorry, but they'll be at NAMI.org. It's after Memorial Day in late May in Atlanta, Georgia. But the following year, uh, actually, I told you wrong. In 2027, it's going to be in DC. Some years we do it online, but there are state conferences. Most every state has conferences as well, much more affordable. Local NAMIs have programming right there within their local community. We didn't mention all the programs. There's also Ending the Silence, which is a school based program where a school can just reach out and ask for a presentation in their school. But NAMI.org, or just Google NAMI and where you live, or NAMI and your state, and you can find what's closest to you.